Are there any new entries you can tell us about?
Well, one area that I think is very important is about palliative care. Though we've had entries in the past about general descriptions of palliative care and hospice care, we've added several others to deal with particular, I would call specialty areas within palliative care. And one that's a very important and new trend is primary palliative care. Often, palliative care has been delivered in acute care settings, but primary palliative care is really addressing the needs of persons at the terminal stages in their disease trajectory that require much more than physical care, but also the psychosocial care, the emotional support for themselves and their family. And so we have some new entries that address that area of primary palliative care, which I think is important because we know in this country that many people do not receive palliative care, and people receive very little hospice care when they're at that very last stage of life. And part of that is because healthcare providers are not familiar enough with palliative care and how to integrate that symptom management and psychosocial care within their practice. So I'm very excited that we have many more entries addressing that topic in this edition. The other area that we have a lot more content is about models of care. And as our healthcare system is changing in general, I think that with this growing older population, and of course, as I've said, about trying to keep older people at home as long as possible, as long as that person chooses to, that models of care that have been that may have been around for a while, such as ACE, acute care for elders, and the geriatric resource nurse model and the health model, and other models like that. There is more work that's needed in those areas to make sure that those principles of those models of care are integrated more fully into our healthcare system. And so we've provided a great deal more of content in that area as well.